Hello guys, welcome back to my YouTube channel. Till now we have covered till chapter 11th of perio. Now we are on chapter 12, which is periodontic instrumentation. So we'll start with the first question, which is all of the following are contraindication for root planning. Okay, all are contraindication except recession. Okay, sorry, except recession. Okay, like deficient or overhanging margin of the amalgam, restoration, caries of the decalcification and root roughness, they are caused by previous instrumentation must be recognized and differentiated from the subgingival calculus. Okay, so all are contraindication for root planning except recession. Okay, deficient or overhanging margin of amalgam restoration, erosion, root caries, they all are contraindicated for root planning except recession, because there will be just recession of the gingiva, no problem. Okay, while sharpening curate and sickles, the internal angle of 70 to 80 degree must be preserved between the face and the lateral surface. Next, during activation of the scaling instrument, the facial surface of the blade and the tooth surface should form greater than 45 but less than 90-degree angle. Okay, so it's like the optimal angulation during scaling and root planing should be 45 to 90 degrees. In general, hand sharpening of the instrument with unmounted stone is preferable to sharpening by motor driven mounted stone, because what unmounted because unmounted stones wear away less of the instrument surface. Okay, because they wear the instrument surface. नेक्स्ट पे आ जाते हैं हम क्वेश्चन नंबर 5th. Which part of the instrument should remain parallel to the long axis of the tooth? So it's very easy, it's the shank which is parallel to the tooth. ठीक है, ये था ना हमारा ब्लेड, शैंक और ये हैंडल, तो इट शुड बी पैरेलल टू द लॉन्ग एक्सिस ऑफ टूथ. Next, ultrasonic scalar dislodge only calculus that is in direct contact with the tip. Okay, which of the following instrument has 2-point contact with the tooth? So it's हो. ये आपको याद भी रखना होता है कि 2-point contact कौन सा इंस्ट्रूमेंट बनाता है, तो इट्स हो. Next, question number 8, which says which of the following is not true about ultrasonics? So अल्ट्रासोनिक दे विल रिलीज एनर्जी, जिसको हम बोलते हैं कैविटेशन. ओके, acoustic streaming and implosion. Okay, but it will not oscillate between 15,000 to 30,000, 3,000, 1,500 to 3,000, but it oscillates between 20k to 45k. Okay, so first option is not correct. So what happened is the spray which is directed at the tip of the instrument, they dissipate heat and form tiny vacuum bubbles that collapse quickly, and they release energy by the process which is called cavitation. Okay, so the first is not correct about this. Question number 9, a tight grasp by the operator on the explorer will, if you put a tight grasp, then what will happen? It will prevent the tactile sensitivity. You will not able to feel it. Next, sharpening of the dental instrument is helpful in increasing the efficiency because it will reduce the slippage and less tissue damage, increase the tactile sensation, and it will decrease the muscle fatigue. So all of the above. Next, Arkansas stone is lubricated with light mineral oil to prevent heat buildup, remove the metal particles, and it prevent it from drying up. So all of the above. Now furcation is measured by, so furcation we measured with neighbor's probe. Okay, there are different type of probe, you should remember those probes. Marcus color, UNC 15, Michigan, neighbors, WHO, Williams. Okay, next, when scaling and planing, the primary object of the procedure is to restore the gingival tissue to health. Okay. 14th, following scaling a patient notice hard black deposit. This may be hard black deposit जो होते हैं they are due to shrinkage of gingiva. Next, because when the gingival shrinkage, this causes the exposure of the subgingival calculus, which is in the form of hard black deposits. Okay, so this you will see. Next, the diameter of the tip of the periodontal probe is it's 0.5 millimeter. Next question पे आ जाते हैं हम, which is root planing is done to remove cementum that has been altered in contact with endotoxins. The offset angle of the Gracie curate between the blade and the shank. आप बताओ, आपको मैं बता चुकी हूँ already. 70. A dental instrument which create aerosols containing large number of microorganism is ultrasonic scaler. So only this much. I think few questions are missing.